Pregnancy and Birth the Truth will tell you everything you need to know about pregnancy, birth and beyond. You'll get the facts from our experts, midwives and doctors, as well as essential words of wisdom from the women who've been there and know the truth. Coming up in this programme, pethidine, a drug that can be used for pain relief during labour.
I think pethidine is not a nice drug. However, I do believe that there is a place for it in some labours.
Are you aware that a quarter of all pregnancies will end in miscarriage?
Miscarriage is a group of conditions where a woman falls pregnant. Usually the pregnancy is in the correct place within the womb, however the pregnancy doesn't continue.
But first, noises you might make in labour.
When you're in labour, you don't think about what's going on the outside because you're too busy focusing on getting through each contraction, and basically a lot of people, use it as a form of pain relief. I use it as a form of pain relief. It's what women have been doing for years.
I remember lowing with my first baby, and I remember being in the bath and hearing this long, low moo and thinking, where did that come from? And kind of realising it's from me and thinking, actually, no, that's a fantastic noise.
I found it similar to a chant, really, especially in early labour, sort of when you're between that, between the not making any noise and the screaming phase, when you're just sort of pacing and rocking, and it's more of a hum, isn't it? It's sort of a moan. It's not loud. It's very much like meditation. I think it's quite comforting, isn't it?
Just deep breaths.
Ow! I'll take the stinging burning over this.
Very often women are completely silent and they don't make any noise whatsoever. And then sometimes they make so much noise you feel like putting, things in your ears like this. And anything is normal. Silence is normal, screaming is normal. The vast majority of women sit somewhere in the middle, whereas they don't make too much noise during the contractions, but certainly when it comes to pushing the baby out, they will make more noise.
It's a primal scream, and that's all it is. It's a method of pain relief. It's nowhere near as bad as it sounds on the other side, because you're just using it to channel the energy and to channel the contraction through. The baby's coming down and the noise is coming out.
I actually clearly remember apologising to Pete, my partner, and saying to him, I know I'm making a sound like a wild animal, but don't be scared, it's fine, it only lasts for a minute and then I have a break. And I remember the midwives were, oh bless.
Noise is the woman's mannerisms and the noises she's making actually gives me signs that this labour is progressing, and I can watch a woman and listen to her noises and watch her body language to see that she is progressing.
The first time I didn't know what was happening, and I was just going with I was listening to my body, and that's the best thing you can do when you're in labour, because you can have as many doctors and midwives around you, but they don't know what's going on inside your own body. You listen to yourself. This is what you were built to do, and this is what people have been doing for millions and millions of years, and if this is what your body's saying for you to do, then you listen.
I talk a lot to clients about the noises that women make because they're so varied. Some women noises are very, very sexual. For other women it's kind of roaring. Kind of grunting, like they're constipated. Primeval animal noises. But I think in terms of noise in labour, what is really important is that noises are pitched low and deep, because if you're making high shrieky noises, then it means you're carrying tension here, and you're tensing up and you're tightening. So if you find yourself or your partner kind of shrieking and making high noises, then encourage them to make kind of softer, lower, kind of deeper noises that are pitched much more down into the belly and kind of creating air and space in the belly.
Don't keep them quiet. Encourage them to make as much noise as they need to do.
Miscarriage is a group of conditions where a woman falls pregnant. Usually the pregnancy is in the correct place within the womb, however the pregnancy doesn't continue. So commonly a woman would come having thought she was pregnant, having done a pregnancy test because she'd missed a period, found it to be positive, and then had some bleeding. We would investigate that clinical situation with an ultrasound, and the ultrasound in a miscarriage would show perhaps a sac with no fetus inside, or a sac and a fetus smaller than we would expect from the number of weeks since her missed period, and no heartbeat in the fetus. And this would be what's called a missed miscarriage or an incomplete miscarriage.
It depends on the gestation as to how the miscarriage occurs. If it's very early, sometimes a woman won't even hardly lose any blood or anything because the body reabsorbs the pregnancy. And I've known women of 8 weeks who have miscarried and, as I say, basically haven't lost hardly anything. As the pregnancy progresses, there's more likely to be more blood loss, and you may see something formed, depending on how far along you are.
With the first one, it was a bit of a shock because I didn't even know I was pregnant. I just started bleeding majorly and stomach pains and just thought I was dying basically. And I went to hospital and they said, "Oh, you're losing the baby," and I was like, "Oh, what baby?" Which was a bit surreal.
I've had quite a few miscarriages, 4 or 5 in the past, and they've all been before 6 weeks pregnancy, so I'm only just pregnant.
I don't always advise women to go to hospitals because the vast majority of the time the body will deal with it perfectly all right on its own, and weigh that up against having an invasive procedure in a hospital. And we have learnt that the instruments used to scrape out uteruses have done more damage than what the miscarriage could potentially do.
15 years ago, almost every woman who was in that situation opted to have a D&C operation, which is a stretching of the neck of the womb and a gentle scrape of the lining to remove the pregnancy tissue, particularly to remove the placenta. However, now we know that if people don't undergo the surgical option, most of them tend to complete their miscarriage as a heavy-ish period, sometimes quite a heavy period, which a woman would have to be prepared for. But usually the pregnancy sac and its contents would come out amongst some blood clot, and the woman escapes surgery that way and any complications in relation to surgery. And now I would say approximately 50% of women wish to be managed conservatively.
I had a D&C with the first one because it was so far on, but the others have all been about 8-9 weeks, and I haven't needed a D&C then.
So again, let nature take its course. In the vast majority of cases it'll be fine, as long as the bleeding ceases after the miscarriage, as long as there's not a foul smell to any discharge that's left after the miscarriage, as long as there's not any increase in temperature and some other signs of infection, then probably the body has dealt with it perfectly okay.
There are some medications which are similar to the medications we use for inducing labour, which can be used to speed the onset of miscarriage, but they're not in wide use throughout the country yet, and to an extent they're still being trialled for their effectiveness and their safety. But it may well be that a little bit along the lines of medical termination of pregnancy, that some of those medications may be routinely used in miscarriage in the future.
Miscarriage can also cause great emotional pain.
Miscarriage is a strange thing to happen because your hormones are all over the place, aren't they? And you're really happy and excited because you're pregnant, and your body still thinks it's pregnant, but you've actually lost the baby. It's a really head-confusing time.
With the other miscarriages, I've been lucky that they haven't been, well, lucky is a relative term. I've been lucky that I've not had any pain, I've just had bleeding. So it was, sad, but It happens.
And with each of my miscarriages, it's been horrible, it's been traumatic, but I've accepted it, and that's been okay. And I just feel with each of my miscarriages, there was a reason for that baby going. And I'm fine about those, actually. I don't have a problem with them. I think because I have got two beautiful, healthy, happy children, you can accept those.
As 25% of all pregnancies end in miscarriage, it's not that uncommon and shouldn't affect your chances of conceiving again.
If the body's meant to get pregnant, it will get pregnant. I don't think there's any evidence to say you should wait 6 months, 3 months, 1 year, or whatever. A woman's body is designed to experience pregnancy, and it all comes down to how she feels. If she feels she wants to try the next month, if she gets pregnant, the chances are it'll be a very normal pregnancy. If she wants to give her body a few months to get well, get over it psychologically, that's fine too. So again, it's all about the individual woman, how she feels.
For Victoria, although having a miscarriage was traumatic, it didn't affect her future pregnancies, and young Esme is the latest addition to the family. However, there are a few women who will have recurrent miscarriages, and there are numerous causes for this which should be investigated by your gynaecologist. Coming up in part 2, massage for labour, an alternative pain-relieving therapy.
The massage is not just random touch, it works in combination with breathing. And the actual lower back massage techniques work very much over acupressure points and are there to support from a pain-relieving element.
And making informed choices about your pregnancy and birth.
And don't be frightened about it, believe that you can do it. And go into it to the very end thinking, I can do this, and get all the support that you can get.
In Banbury, Oxfordshire, Linda Kimber runs an award-winning series of classes on massage for childbirth.
I started looking at massage to support women in labour in about 1997-ish, and then it's really developed from there. The aim of it really is to support women and their partners with pain relief, a pain-relieving strategy during labour. It's grown through feedback from the couples in the initial years, so I continued looking at developing it really.
Linda found that focusing on the back part of the pelvis and timing the strokes to the woman's breathing would help keep her focused and relaxed.
The moves have been structured to also work with breathing control, because the massage technique is not just random touch. It works in combination with breathing. And the actual lower back massage techniques work very much over acupressure points and are there to support from a pain-relieving element. Other of the techniques that work with the breathing control work primarily with relaxation, breathing control, relaxation, and then the woman gets some pain relief. So the lower back ones are primarily there for pain relief.
Linda gets the birth partner to practice regularly, so that when the time comes, their technique has been perfected.
I don't think any of it's very difficult. It's just the practice and really learning about it. And so it's synchronising the breathing with the massage that creates that relaxation, and the actual techniques work very much with supporting pain relief as well, the lower back ones. Ideally, the program starts about 35, 36 weeks of pregnancy. The couples practice antenatally until the woman goes into labour. They're given a sort of practice schedule, and then they use it in labour, hopefully right through the labour.
Student midwife Natalie was keen to try the technique after seeing the results firsthand.
Yeah, I have, and I've seen it work really, really well, which was why I was really keen to come along and do it.
And Jay, you were up for it?
Yeah, anything that makes Natalie feel better and more relaxed during labour is going to be a plus. And also, with her being a student midwife, I feel a bit disadvantaged in not knowing enough, so it sort of gets me a bit more involved, and yeah, seems really good.
Can you manage to get that part of your arm sliding across? because that then actually is quite comfortable rather than just having your hand.
Okay.
Linda's been running the programme for several years at the Holden maternity unit with the full support of midwifery manager Haines.
I met Linda 6 years ago when I came to the Holden as delivery suite manager, and I got involved really as a midwife and also as the manager of delivery suite. I was at the time looking at environmental conditions that women should labour in to benefit them with the physiology of childbirth, to relax, to calm, and we were looking for offering up a non-pharmacological, so a drug-free coping strategy that they could use, again, to enhance the normality of birth.
It's not just the expectant mother who benefits. Massage in labour can have positive effects on the birth partner too.
We found it amazing, the way it reduces the anxiety in the partner, because they're often a little nervous at the beginning of labour, and once they get into the massage they relax noticeably as the mum relaxes. So it works for both of them actually, the partner doing it. And of course it doesn't have to be your husband or male partner, it can be your mum or your friend, your doula, anyone who's going to work with you through labour really. It works very well.
At the moment, we're the only ones that are teaching the programme, but we have recently started some courses for midwives and for massage therapists, for doulas, for anyone actually professional that works with pregnant women, and so they are national courses. And one of the reasons we decided to start this was that we are getting queries from couples around the country asking whether they've got anyone in their area that teaches it. And because we don't, we thought we better initiate something like courses as well to support couples around the country.
During a long or difficult labour, there may be a need for something stronger than gas and air. Midwives in the UK are licensed to administer a drug called pethidine by intramuscular injection. It certainly isn't their first choice for pain relief, but it does sometimes have its uses, as Virginia knows only too well.
I think pethidine is not a nice drug. I think that it does have lots of downsides to it. It can make women feel drunk. It has a very strong amnesiac effect. You lose perception of time. And once it's in the bloodstream, you've got to wait for it to wear off. You can't take it back out again. It does cross the placenta. It can make the baby feel be very sleepy at birth and not feed very well. It can necessitate, with some babies, needed resuscitation. So all in all, it's not an ideal drug. However, I do believe that there is a place for it in some labours. I think that some women can benefit from it. I think especially women having long labours, it can give them a few hours of respite. I think it can help them relax when they're very stressed. But it should be used appropriately.
Claire has been labouring for 2 days with very little sleep, and her midwife Virginia feels that pethidine may help.
Yeah, she's going to have a shot of pethidine to help her get some sleep. It's not her first choice. She wouldn't have written it as a choice in labour, but it's always best to keep an open mind, and for some women it can help them relax for a little while and get over a sticky period and get on to the next stage. So we'll see how it goes. But she's going to try and lay down on her side, having had some pethidine, suck on the gas and air with Tony giving her a cuddle, and we'll see what happens in a few hours. Over the last 7 years, I've probably only used it about 10 times, and we're talking probably getting on for 130 births, so not very often. Most women, if they have a relatively average length labour, don't need it, want it, whatever. Her main priority is sleep at the moment. She needs to sleep. She's been up all night. She was contracting all day yesterday, so she's going to be tired. That's normal. But so our main priority at the moment is sleep, and this will probably help. Basically, when just a woman needs that little bit of oomph to keep going, I think that it has its place. I would be very reluctant to give it to a woman who's had a baby before, because if you give it at the wrong time, it can be have very high levels of it in the baby's bloodstream. And a woman who's had a baby before, who's having a second or a subsequent baby, she could be 2 centimetres dilated 1 minute, and the next minute her baby could be born. You can never judge when a baby's going to be born with a woman that's had a baby before. So I'd be very reluctant to give pethidine to a woman who having her second or third or subsequent babies. But I think it has its place in first labours.
When you're faced with making a decision about your pregnancy or plans for the birth, try to find out as much information as possible so that you can make an informed choice, as Emma did when her obstetrician recommended that she have another caesarean section and she chose a vaginal birth instead.
I would say find out why they're saying that to you. Was it because of some part of your physiology that means you can't do it? They think you're something wrong with your pelvis or there's something wrong with you. If there's no reason, if your previous caesarean was because the baby was distressed for any number of reasons but not because of your body, then I'd ask why can't I give it a go, because there's no reason why it should happen again, and ask to be given a go, really, and feel really positive about it, and don't be frightened about it. Believe that you can do it and go into it to the very end thinking, I can do this, and get all the support that you can get, and don't listen to them. You hear one negative thing, go and try and find out something positive. Talk to people, find a good midwife who'll support you. That's what I would say. And believe in yourself.
By making an informed choice and understanding the risks and feeling confident that her body could do it, Emma gave birth